I'm good. Yeah, very good.
Good morning. I want to welcome us to this morning round presentation, the first for this year 2022. Today, the 23rd of February, we are having the nursing service department in the house. They have come to tell us about our kidney, and the topic is you and your kidneys. Kidney is one of the respiratory organs of the body. I won't say more than that. The beautiful nurses in the house are here to tell us all we need to know about our kidney. We have two presenters for today's program. We have ADN Adeyefa and we have SNO Akimbodi. They'll take the presentation in turns. So let me welcome the first presenter in the house to tell us about what we need to know about our kidney. That's it.
Thank you. Please permit me to adopt the already established protocol. Good morning, distinguished participants. Nurse Adeyefa Lighter, and to my right is Nurse Akimbodi Matthew. Okay. We are representing the Services Department, and the topic we'll be presenting is titled You and Your Kidneys. Following this outline, an objective are to increase the awareness of the importance of the kidneys to our health, to highlight the burden of kidney diseases and encourage and to reduce the impact of kidney diseases and associated problems in our community. The kidney is one of the essential organs for survival in the human body. The kidney is an amazing organ that is equipped with peculiar qualities that enables it to perform some unique functions that are essential for the existence. Kidney disease is the major cause of catastrophic health expenditure, with its fiscal toll estimated to be about 3% of annual healthcare budgets in high-income countries. The global burden of kidney disease is rapidly increasing, with a projection of becoming the 5th most common cause of years of life lost globally by the year 2040. However, the onset and progression of kidney diseases are preventable. The kidney can be described as a bean-shaped organ of excretion. It receives approximately 25% of cardiac output per minute, taking between about 200 liters of blood in 24 hours. Its gross features are the outer fibrous capsule, the cortex, and the inner medulla. And microscopically, the nephrons are the functional units of the kidney, and the kidney forms part of the urinary system. The urinary system consists of 2 kidneys, 2 ureters, 1 urinary bladder, and the urethra. And they serve as a plumbing system for the production, transportation, storage, and expulsion of urine. The major functions of the kidney and the urinary system. The kidney helps in the regulation of blood ionic composition, and it does this by maintaining relatively constant levels of key ions such as sodium, potassium, and calcium. The kidneys also help in maintenance of blood osmolality by keeping the extracellular compartment from becoming too concentrated or too dilute with respect to the solute in the fluid. Blood volume is also regulated by the kidneys by controlling water, sodium and water balance. and the kidney produces an enzyme called renin that helps to regulate blood pressure. Another function of the urine is that the kidney is that it helps to regulate the acid-base balance of the blood. The kidney also produces an hormone calcitriol, which is needed for activation of vitamin D that helps to control calcium homeostasis and is essential for healthy bone growth. The kidney also produces another hormone called erythropoietin that helps to stimulate red blood cell production. And red blood cell is essential in the transportation of oxygen throughout the organs and tissues of the body. Another important function of the kidney is that it helps in the regulation of blood glucose via gluconeogenesis, and it is seen in the filtration and selective reabsorption of glucose during urine formation. When there is impairment of the kidneys, it manifests in two ways, either acute kidney injury or chronic kidney disease. Acute kidney injury can be defined as a rapid decline in renal function, resulting in the retention of urea and other nitrogenous waste products, and it is reversible. For chronic kidney disease, it is an insidious decline in renal function or a glomerular filtration rate of less than 60 ml per minute per 1.73 meters squared, and it is irreversible. For acute kidney injury, there are three types. It could be a prerenal acute kidney injury when there is marked decrease in renal blood flow, or an intrinsic acute kidney injury, which is seen when there is a damage to the structures within the kidney itself. And it could be a postrenal acute kidney injury, and this occurs when there's an obstruction of urine outflow from the kidney. Causes of acute kidney injury. The mechanism of kidney injuries with infections are divergent. Infection can cause kidney injuries either by direct invasion of the offending or invading microorganism or by immune mechanism. Another cause of acute kidney injury is when there is severe dehydration, excessive fluid loss. When there is severe dehydration that can mark a decrease in renal blood flow, as seen in excessive fluid loss. You can see when there is severe vomiting or instances of severe diarrhea. Severe hemorrhage. Blood loss can cause acute kidney injury when the kidneys are not able to receive the 25% appropriately. And it is seen in when there is severe blood loss from maybe road traffic accident, from severe postpartum hemorrhage, or even from major blood loss during surgery. Transfusion of mismatched blood. This leads to hemolytic transfusion reaction, and it is life-threatening and can potentiate kidney injury. Another cause is when there is an impaired cardiac efficiency. This reduces renal perfusion and can be seen when there is heart failure or myocardial infarction. Indiscriminate drug use. Some drugs are actually nephrotoxic, and it actually needs to be prescribed by trained personnel. So indiscriminately consuming these drugs by purchasing them over the counter, especially non-steroidal anti-inflammatory drugs, and even some antibiotics like gentamicin, can potentiate acute kidney injury. Concoctions. When they are ingested, these concoctions are in their natural form, plants and herbs. And some of these concoctions, because it has no dose and they are being ingested indiscriminately, can also lead to acute kidney injury. Some postrenal acute kidney injury can be caused when there is occlusion of renal pathways, as seen when there is kidney stones, or extrarenal occlusion, as seen when there is enlarged prostate or compressed urethra, can all lead to acute kidney injury. For chronic kidney disease, it can be caused in instances when there is uncontrolled hypertension, uncontrolled diabetes, Inflammation of the glomeruli and the small blood vessels, as seen in glomerulonephritis, can cause chronic kidney disease. Obesity is a potent risk factor of the development of acute chronic kidney disease. We also have some congenital abnormalities that the patient has no control over because it's caused by genetics or by embryonic development of the embryo, the fetus. And examples of such is when you have polycystic kidney disease, posterior urethral valve, dysphagia 2, amongst others. Early detection of these congenital abnormalities can lead to monitoring and slow down the progression of the disease. There are some kidney factors that may insidiously affect the kidneys over a long period of time. An example of such is artificial ripening of fruits. Some of these fruits that we consume are artificially ripened by some chemicals that are injurious to our health. An example of such chemical is calcium carbide, because it contains trace of arsenic and phosphorus hydride. When ingested, it can affect our kidneys over a long period of time. Use of bleaching agents. Bleaching agents are products that are applied to the body to achieve an overall light complexion. And it is associated with adverse clinical conditions, such as exposure to skin cancer, kidney injury, which can cause mercury poisoning, and severe skin damage. Food processing too with some chemicals. There are some chemicals that are used to process our food which are not hygienic or can affect the kidneys, and such detergents, some food colorings, preservatives, or even additives. Apart from affecting the gastrointestinal tract, it can potentiate kidney injury over a long period of time. Exposure to heavy metals. These metals, the exposure to it could be therapeutic exposure, it could be occupational exposure, or it could even be an accidental exposure. And how it gains access to the body could be by ingestion, inhalation, or absorption. And the kidney is the first target organ of heavy metal toxicity. And examples of such metals are mercury, lead, hydroquinone, some hydrochemicals, pesticides, fuels, and paints. I will now hand over to the next presenter to continue with the presentation.
Permit me to start on the, permit me to adopt and proceed on the already established protocol. Thank you, ma'am. The risk factors of kidney diseases are as follows. Uncontrolled hypertension and uncontrolled diabetes are the leading cause of kidney disease. Family history of kidney disease can also predispose one to developing kidney disease. Race, it's higher in Aboriginal, African, and Hispanic, and Asians. Risk of kidney disease is also high in obese individuals and more common in elderly from age 60 and above. Abnormal kidney structures can also be a risk factor. Other exposures to some chemicals, other medical ailments such as HIV and sickle cell can also predispose one to kidney disease. Frequent use of over-the-counter medication can also be a risk factor to chronic kidney disease. prevalence of kidney disease. Kidney disease is of global occurrence and it's considered an important factor for cardiovascular disease. Based on International Society of Nephrology, the 2019 Global Kidney Health Atlas cross-sectional survey, the average number of new end-stage renal disease diagnosed worldwide was 144 individuals per a million general population. Also, the number of people receiving renal replacement therapy exceeds 2.5 million, and this is projected to have doubled by the year 2030. Studies have shown that the occurrence of renal disease resulting in end-stage renal disease is essentially the same both in whites and blacks. Diabetes and hypertension contribute to more than half of deaths resulting from chronic kidney disease. In sub-Saharan Africa, recent studies conducted shows that 13.9% and 10.1% respectively are diagnosed of chronic kidney disease, while West African has the highest number of 16%. In Nigeria, a study conducted by the Renal Study Group shows that the number of individuals affected with chronic kidney disease is 12%, and this is more common among the middle-aged urban population and most common among women fueled by diabetes, aging, obesity, and albuminuria. Acute kidney injury has a low report because of the burden of the disease and also late presentation of patients in the healthcare facility. In our institution, the prevalence of kidney disease among the pediatrics within the period of June 2018 and July 2021 shows that the presentation of children having chronic kidney disease within that period and acute kidney injury with nephrotic syndrome are about 150 between male and female gender. And in the emergency pediatric units, the number of patients presenting with chronic kidney disease are much higher. This shows that there is late presentation among community members. In the adult clinic, patients are attending renal clinic in the University of Ilorin Teaching Hospital. Within the same period of July 2018 and June 2021, this shows that more female patients were affected with kidney disease than the male patients. Chronic kidney disease, from this graphical representation, it's high among the elderly, but that is not to say that it affects the younger generation also. The signs and symptoms of chronic kidney disease. Kidney failure is a multi-organ health issue with a variety of cross effects affecting different systems of the body. The following are the cardinal signs and symptoms: changes in urine frequency and urine volume, protein in urine, blood in urine, fluid retention shown in facial puffiness and generalized body swelling, high blood pressure, anemia, shortness of breath, nausea and vomiting, confusion. To establish the diagnosis of kidney disease, a comprehensive history taking with physical examination is important. Also, the test of urine to analyze the urine components, and that will help to discover the presence of kidney disease. Blood tests to evaluate the electrolytes and the urea value in the blood. Also full blood counts. Imaging such as renal ultrasound to show the echogenicity and corticomedullary differentiation and the size of the kidney. A renal biopsy can also be a diagnostic tool, and it can also be used to monitor the progress of the disease and the prognosis. The preventive measures: keep fit and active to avoid obesity, maintain personal and environmental hygiene. Preventive measures also include proper control of blood sugar and control of blood pressure within safe limits. Maintain a healthy eating lifestyle, moderate carbohydrates, moderate protein, cholesterol-free oil, low sodium. Stay well hydrated. Take between 2 to 2.5 liters of water daily and avoid soda. Avoid drug abuse. Ensure periodic medical checkup in the healthcare facility. All women in the reproductive age are advised to present early in the healthcare facility. This is to monitor them closely to avoid pregnancy, complications in pregnancy that might lead to kidney disease, and also to detect early if there is any congenital abnormality in the fetus. Quit smoking. In the hospital, the healthcare worker are advised to monitor patients closely, provide adequate hydration to patients at risk. Those at risk are the unconscious patients and post-surgical patients. Prevent and treat infection promptly, and constantly assess patients' renal function. The management of chronic kidney disease. For acute kidney injury, the management is focused on preservation and optimization of the renal reserve function. While for chronic kidney disease, although there is no cure, but the management is also aimed at ameliorating the signs and symptoms, also to reduce the risk of complication and further slow the progression of the disease. The management are further divided into two: conservative management and renal replacement therapy. For conservative management, this involves lifestyle modification and medication. For lifestyle modification, maintain normal blood pressure and all other risk factors. Medication is individualized. Patients are reviewed by the nephrologist, and patients are further counseled and prepared for renal replacement therapy. For renal replacement therapy, these are divided into two: dialysis and kidney transplant. Dialysis could either be hemodialysis or peritoneal dialysis. And complications that may arise from chronic kidney disease, are fluid retention, hyperkalemia, anemia, increased risk of bone fracture, and end-stage renal disease. The prognosis: acute kidney injury can be fatal, but if earlier detected and promptly managed, the kidney function can be returned to near normal. Whereas chronic kidney disease, the prognosis is poor because the onset is insidious and patient may progress to end-stage renal disease. I hereby hand over to my co-presenter.
Thank you.
Thank
you. I'll continue with the nurse's role in the management. That's talking about the scope and standard of practice. It is the responsibility of all trained nurses to care for patients suffering from the real or threatening impact of renal diseases. However, nephrology nurses have more specific functions. Nephrology nurses are an integral part of a multidisciplinary team that care for patients with complex needs. They have their roles in prevention and early detection of renal diseases, in conservative management, and they act as advocates, care coordinator, and direct caregivers. And nephrology nurses initiate prescribed treatment modalities. Nursing care is given wherever there's a patient in need of care and whenever there's need for nursing knowledge, compassion, and expertise. And how this is done deals with the standard of practice. And the standard of practice defines the diagnostic, intervention, and evaluation competencies. And this entails the use of critical thinking skills, engaging in therapeutic and professional relationships, maintaining capability for practice, and providing a safe, appropriate, responsive, and quality care. And all these are aimed at providing optimum and excellent nursing care that's tailored towards each patient's needs. Nephrology nurses also adopt the 60 set of core nursing values that are hinged on selected and adaptable nursing theories. The primary concept of using adaptable nursing theories is to provide a positive outcome for patients through professionalism. The 60 core nursing values are care, compassion, competence, communication, courage, and commitment. Care defines what nurses do, caring for our patients rightly and consistently. And compassion explains how the care is given with dignity and empathy. Competence describes the use of being proactive and taking the right action. And it requires using of our skills, knowledge, and expertise. Communication is central and essential to any successful caring relationship. Courage in this context means being brave and at the same time having empathy for our patients, giving our patients psychological care and emotional care alongside with their significant others as they battle, as they struggle with coming to terms with their clinical diagnosis. And commitment is in 3 stages. Commitment to our patients by giving them the optimal care, commitment to ourselves as nurses by taking care of our health and serving as role models, and commitment to the nursing profession by practicing it faithfully and promoting the profession. Our specific care in renal care center where I teach. Nurses in renal care center, like other units, utilize the nursing process framework of practice to care for our patients with renal diseases at any stage. And the framework includes nursing assessment, nursing diagnosis, setting of objectives, planning, implementation, and evaluation. Nursing assessment stage is a stage where there is comprehensive data collection, and that would lead us to validating and having a nursing diagnosis for the patient. A nursing diagnosis is a clinical judgment of our patient's response to an actual or potential health need. and it focuses on the physiological and psychological responses. When the nursing diagnosis have been known, objectives are set, and they are planned and prioritized, implemented, and subsequently evaluated. Our work in inpatient setting. This is a pictorial representation of a cross-section of the renal ward of UITH. And renal ward comprises of 8 beds, 5 beds in the main section, 3 beds in the female section. And basically, we know our patients conservatively, and we give individualized care. Our patients' needs are experienced along a continuum, which is the health illness continuum. And patients' needs determines our nurses' roles. And the goal is to restore our patients to optimal level of wellness. But at some point on the health illness continuum, when the goal cannot be achieved, maybe due to the patient's clinical or deteriorating condition, death could be an expected and acceptable outcome. And at some instances, the role is to nurse the patient to peaceful death. We assess and monitor our patients, arrive at nursing diagnosis, and treat the human responses exhibited by the patient, such as physical symptoms, functional limitations, psychosocial disruption, and knowledge needs. We educate our patients, counsel them, administer prescribed medication, and we give palliative and supportive care. This is a pictorial representation of our hemodialysis unit of the hospital, comprising of 6 stations, 5 hemodialysis machines. Presently, 2 are functional, the remaining 3 are under repair. And we do hemodialysis for our patients. We counsel them pre-dialysis, assess and ensure they are fit, and we ensure that consent form is signed at the first instance. We assist our nephrologists when security vascular access, and we ensure the machines are working optimally. We dialyze our patients according to doctors, nephrologists' prescription, and patient's tolerance. And we monitor our patients intra and post-dialysis. We troubleshoot when necessary and notify nephrologists in case of adverse reaction. This is a pictorial representation of the peritoneal cycle peritoneal machine that we have in the unit. It has been procured long ago, but it has not been in use ever since, due to the fact there's non-availability of the fluid in the country. A couple of months ago, the fluid is not available, but we are yet to start it in the hospital. Kidney transplantation. Nephrology nurses provide pre, intra, and post-operative nursing care to patients. We have had 1 kidney transplantation done in the hospital in 2012. It was successful, with both the donor and the recipient doing fine as a reporting time. We are yet to have another kidney transplantation done ever since. Nephrology nurses also take care of patients in the comfort of their homes by dialyzing our patients and also doing remote monitoring and telehealth. But in this hospital, we have not reached that stage because most of our patients are financially constrained and can't afford it. We reach out to our patients, outpatients, in a renal clinic by counseling them, and also join our seasoned nephrologists and renal technologists in reaching out to a larger society during What Kidney Day. What Kidney Day is a global health awareness campaign that focuses on the importance of the kidneys to our overall health. And it's a joint initiative of the International Society of Nephrology and International Federation of Kidney Foundation. We raise awareness and we screen our patients for real kidney diseases and monitor them thereafter. In the school setting, nephrology nurses work either as a nurse educator or clinical instructor. And this is to increase the capacity for renal care by training nurses in the field of nephrology nursing. Nephrology nursing serves an umbrella with other subspecial skills within it, such as hemodialysis nursing or pediatric nephrology nursing, amongst others. In summary, kidney problems can develop suddenly or over a period of time. Hospitalized patients are at risk of developing kidney injury if they are not well managed. There is no cure for chronic kidney disease, but we've been managed so as to enjoy good quality of life. In conclusion, kidney health is directly related to the overall quality of life of an individual. Optimal function of the kidney is essential for healthy existence. And living a healthy lifestyle and being proactive go a long way in preserving kidney function. Prevention is better and cheaper than cure. Hence, the need to adopt a kidney-friendly lifestyle. Appreciation. Nurses, as healthcare providers, have a wide scope of practice and approach to care of patients. Our sincere appreciation goes to the management and the leadership of our visionary and dynamic chief medical director, Professor Abdullahi Silva Yusuf, for supporting and investing in the training of nurses in different fields of specialties. In the quest to meet up with global health standards, a new highly efficient water reverse osmosis machine that can efficiently supply treated water to 50 hemodialysis machines was recently procured for Renal Care Center. The unit has been promised a state-of-the-art building. Previously trained nephrology nurses were also released for refresher course, which added value, national recognition, certification, and licensure by the National Medical Council of Nigeria. We also appreciate the head of Renal Care Center for his leadership and coordinating role. We appreciate the management for their constant support, and we humbly recommend the following: an advancement and refurbishment of Renal Care Center in terms of space, manpower, and equipment, so as to enhance productivity and improve quality of care. Procurement of more hemodialysis machines to serve our increasing number of patients and to reflect the training center. Procurement of new versions of user-friendly peritoneal dialysis machines and its softwares. Introduction of dialysis public-private partnership to increase patients, needy patients. The provision of constant and predictable electricity and water supply, employment of more nephrology nurses, and updates and continuous training of nephrology nurses and renal technologies to enhance the efficiency. To the government, we recommend complete coverage of renal replacement therapy for all patients, and all agencies in charge of quality control, such as NAFDAC, to intensify measures in monitoring of products to ensure safety, and also regulation on exposure to heavy metals. To UITH community, we recommend that we educate the general public, the women of childbearing age, to seek professional care before, during, and after delivery. And to us all as individuals, we recommend that we all go for regular medical checkup and follow up, and we should all adopt a healthy lifestyle. Our take-home message is that let us create the awareness, and let us all adopt good lifestyle modifications. Let's play our roles in adequately taking care of our patients. Prevention is cheaper and better than cure. These are our references. Thank you all for listening. Thank you so much for that. I think we want to acknowledge I want to also acknowledge the impact of the special for pressure, comments, data. That's one of the ask what we are there.
Sorry, we cannot hear you, please.
Okay, this is question time.
Okay.
This is comment time. This is commendation time. If you have anything for the nurses, you have questions for them, we are here, fully loaded with facts and figures. So if you want to say something, if you want to contribute, kindly raise up your hand, then you unmute yourself so that we can hear you. Yeah, I can see some commendations going on. Thank you
Stop
for
sharing.
that.
Stop sharing your stuff.
Thank you for the commendation.
Stop.
So while I wait, questions, remarks
Hands are up.
from the.
Hands are up. No. So, no. One second. You can call these points. These are people. Ask them to ask questions. They can omit.
Okay, Madam Musmala,
no, only question. You can call her to ask question or make contribution.
Okay, yes. If you have any contribution.
No. Any. Call her name Musmala.
Okay, that's our chair.
Yeah,
you are welcome, ma'am. Please kindly unmute yourself and speak. We are hearing you.
Thank you very much. Good morning, everyone. And thank you to the nursing department for an educative morning on a topic that is essential and affects virtually all of us, if not personally or by extension, members of friends that we know have some challenges with the kidney. Thank you for bringing this to the fore this morning. And thank you everyone who has in one way or the other participated in the morning this morning. At least we have virtually over 80 people at each point in this presentation, which is remarkably good for the morning and for the new year. We hope we can actually have a larger crowd subsequently for other presentation. I really don't have any question, but I hope that when the next presentation, I'll just, I think it's an in-house, which I'll discuss with my people with them. Thank you all for being present this morning.
Thank you, Ma, for your commendation. We really appreciate your contribution. For now, let me give the floor for Head of Department Nursing. She wants to tell us some things. Welcome.
The Chief Medical Director, the CMA, all professors and every participants. Today may not be the World Kidney Day celebration, but every day should be the World Kidney Disease Prevention Day. As nurses, being the largest workforce of any viable healthcare system, we work round the clock to improve the quality of and provide safe care to our clients. Our primary aim as practitioners is to promote healthy living and prevent illness or diseases among the populace without preference for any ethnic, religious, or political affiliations. One of such diseases is the kidney disease, which may be acute or chronic. Much has been said in the presentation, and what we bring to the table of care explained therein. I would like to humbly acknowledge the contribution of the management under our dynamic Chief Medical Director, Professor Edi Yusuf, towards our effectiveness and efficiency at work. This has been displayed through the provision of state-of-the-art equipment for care of the patients with impaired renal functions, release and sponsorship for the post-basic specialty courses, and other plans waiting in the pipeline. Maintenance of electrolyte balance is only ensured through functional kidneys, hence the reason for the choice of this discussion. The global increase in its mortality and morbidity rates cannot be overemphasized. Common local risk factors and predispositions were highlighted during the presentation, and it suffices one to know that everyone may either become a culprit or a victim. The entire UIT nurses hereby charge the public and hospital community to take their kidneys health seriously via lifestyle modification practices ranging from alcohol-free, tobacco-free, additive-free, exercise-guided, etc. lifestyle. Finally, with the common saying of taking our daily meal like medicine, so as not to take a routine medication like our daily meal. We advocate the need for adequate and balanced nutrition for every home. While it be restricted to modification in cases of kidney disease, one may not worry, but it has just been mentioned that kidney disease is terminal, hence the strong relevance of its prevention. Thank you all for listening.
Thank you, Ma, for that contributions. I have a host of people who want to contribute too. Adebi Aderibigbe, sir, please kindly unmute yourself. Please unmute yourself, sir.
Hello, can we call someone else?
Adebi Aderibigbe, are you still there? If you are there, please make your...
Sorry, thank you very much. I'm sorry I had a little distraction.
All right, sir. Thank you
very much for the presentation. Quite educative and well researched.
Thank you, sir.
Just wish to add some things that renal and pre-renal causes of kidney disease is born. Born people have low blood volume. They are predisposed to low blood volume from the loss of plasma, which may make them to be predisposed to kidney disease. Reason why we are very aggressive with their rehydration, and more so when they have a special form of burn, like electrical burn or chemical burn, they likely will have some myoglobinuria and hemoglobinuria that likely will affect the kidney directly. So a renal cause of kidney disease, even in this born patient, and even very deep burns, exposed to both myoglobinuria and hemoglobinuria that may, they are very toxic to the kidney. So the reason why we are very aggressive also with rehydration and forced diuresis in this group of patients. I know that my born nurses will really appreciate it. The reason why their care is critical at the very first 24, 40, 72 hours of care. Reason why we still use the kidney as a source of monitoring them by using hourly urine monitoring, such that these patients are actively monitored, both by the kidney, and are protected from kidney disease by actively resuscitating them in this active area time of their injury. Therefore, I really appreciate the nursing for this wonderful presentation, and one would not expect anything less from very respectful group of people like this. Thank you very much.
Thank you, sir. Thank you very much for the commendation. We really appreciate you. Professor Akande, please. Can you unmute yourself? Thank you,
Good morning, all. I hope you can hear me.
Good morning, sir.
Yeah, thanks for the presentation.
Thank you, sir.
I was just looking forward to hearing about the challenges we have with as regards nursing in managing the renal patients. They were not clearly highlighted, because I know in this part of the world there are a lot of challenges. Also, that some of us have had patients there in the past. I know that some of the challenges which will be somewhat related to the hospital, some even on the part of the patients. It would be so good to hear a few of those challenges.
All right, sir. We are hearing. Thank you, sir. Thanks for your contribution. I don't know if Dr. Yereko is still with us. Kindly unmute yourself and speak.
Good morning, ma'am. Good morning, everyone.
Good morning, sir.
I want to thank the existing protocol. I want to thank the nursing department and the presenters for this educative and informative presentation. They went all on to talk about the presentation. You and your kidney is very important, because there seems to be an epidemic of kidney issue. People are just wondering as if, is it a spiritual attack? What is it? But they have talked about some of the things that are possible cause of kidney issues in kidney disease in the hospital. So I just want to talk briefly on some of the things. They have talked about hypertension and diabetes being top causes of kidney disease. Most people don't do general medical checkup, checking their blood pressure or blood sugar. By the time they come to us, by the time they know they know that they are hypertensive or diabetic, the complication of diabetes has already set in. Because nothing is wrong with them, they don't check their blood pressure, check their blood sugar. And those who are hypertensive and diabetic too, they need good and perfect control of their blood pressure, their blood sugar. And we should avoid exposure, like they said, to heavy metals, chemicals that can be injurious to the kidney. Everybody needs a general healthy lifestyle, low salt, exercise, stop smoking, stop reduction alcohol consumption. These things are very important. And all kind of people who are okay, they just begin to take about concussion. Like some of these things may be very injurious. We don't know the concentration of apps in the chemicals in them, and avoid unnecessary use of drugs or painkillers that are not prescribed to us by doctors. And everybody generally can decide to know the state of their health. Just like we service a car, people cannot know their kidney test. Let's do a kidney function test. Here and you, creatinine, urinalysis. Let me do ultrasound to know about the function of my kidney. Just like we can do to the kidney, to the liver. Health checkup, for especially as people are adult, is very important, so that things can be picked up early. By the time some things are picked up, it's getting too late at the time they are picked up. And people should not just signs to their body. Anything they notice, they should present to the hospital. They should not just try to put things down. And so all kinds of subtle symptoms. Disease may come to subtle symptoms for months or years. People might have just been submerging them. So people should pay particular attention to their health. And we should also know that the weather may be very hot. The issue of drinking water adequately is very important. People should need to rehydrate themselves, especially in hot weather. And when people have things that can cause acute kidney injury, like stooling, vomiting, people should also drink water enough. All things that can cause, like, the people should drink water. Any little things that can affect our kidney, we should pay attention to it. And also, we should know that kidney care is very important. Most of our patients die because there's no money to continue dialysis when eventually the kidney failure enter. So we need the role of government in subsidizing dialysis care. I mean, subsidizing all these payments, and the role of philanthropists and NGOs in subsidizing most of this care. Kidney disease is not a life sentence. Most important thing is that we need to stop the progression of this disease, to reduce or halt the progression of this disease. There are people who are living with, we are managing for like 10 years with creatinine of 200, 300. By paying attention to their lifestyle, what to do, what not to do, they have been able to live elderly like every other person. So once again, I just want to thank the presenter, and I also want us to pay particular attention to our health, avoid things that may be injurious to our kidney, rehydrate ourselves adequately, and also pay attention, do general checkup, check our blood pressure, not just to take drug for blood pressure or blood sugar. Make sure we have good blood pressure and good sugar control. Overall, I want to thank the nursing department again at the presenter, and I hope everybody will live a healthy kidney, live a healthy lifestyle, and will all have a healthy kidney. Thank you very much.
Thank you so much, Dr. Yedepo, a consultant in the Renal Care Center, UITH. We really acknowledge and appreciate your contribution, your laudable contribution. Mr. Mohammed Adeboye, please, if you are still there, Prof, please kindly unmute yourself, sir, and speak. Hello, sir. Hello. All right, sir. We are hearing you. Please speak on.
Okay.
Yes, sir.
All right. So thank you
Good
so
morning.
much.
Good morning, sir.
Good morning, ma. So
Yes,
good morning,
sir.
everyone. Okay.
Good
So,
morning, sir. Everybody is hearing you.
all right. Thanks, ma. So may I start with sending condolences towards the demise of Ms. Salami. Okay, so
Yes,
may our soul, rest in peace. Okay.
Amen. Thank you, sir.
It's still a shock, but it happens like that. But there is something. Okay, so if I might start this small probing from here, among those that have made this wonderful and impactful educative presentation to us this morning, how many have done their, kidney checkups in the last 6 months? Okay, so there is a way we think we are immune to some of these things. As health worker, we think, this can never be our portion. No, it's not like that. I'm healthy. But we tell people, even if you think you are healthy, so you need to check to confirm. And so, we have said it now. So, but how many of us are guilty, right? I know at the level of the consultants, they do something annually. So, but I don't think it should be an annual thing only. So, but if there is no complaint, there is no problem, and it's done somehow regularly. Okay, so it's nice. So that just like Dr. Yedepo said, you are okay, because you are not checking. The complications are probably going on until it becomes unbearable. So before we now see, the complication of this showing, and then it might now be more difficult, or a worse outcome may now be associated with this, right? I think we should move away from the zone of just talking and talking, because talk is cheap, right? So we should think we are also vulnerable. So we are part of the people that we are advising. We advise them, but we don't take the advice, thinking we are superhuman beings. No, we are not. May God save all of us. This is just my little contribution. Thank you very much.
Amen. Thank you so much for your contribution. Our time is fast spent. I just want to give a little time for the representative of the nursing service to give a response to one of the questions. Please speak on. Speak.
Thank you, Ma. One of the participants asked that want to hear the nursing challenges in renal care patient management in UITH. Yes, we actually have some challenges. Firstly, on the part of our patients, they are financially handicapped. Some of them are financially handicapped to access the care. Because in an ideal setting, hemodialysis is supposed to take place 3 times weekly. And our patients cannot financially afford that.
Okay.
Then on the part of the unit, we don't have a constant supply of electricity. And anytime the light goes off, our machine starts, it affects our machines because we don't have any standby UPS. So at times we have to go back to turn patient's blood manually. It's giving us challenges. And apart from that, we have the machines that we have are not adequate. We are building capacity and training nephrology nurses, and they come in numbers. So we actually need more hemodialysis machines so as to reflect what they are doing in the hospital. Number of machines, I've mentioned that earlier. We need more machines. I think I've answered that. Then the next question. You mentioned infertility in the signs and symptoms of kidney disease, that we should elaborate more on it. When we have when these kidneys are impaired, it comes with a patient becomes fatigued, they are anxious, and there are hormonal imbalance. And this could lead to decreased libido. The electrolytes are deranged.
Are you too, ma'am?
Yes, ma'am.
Yes, Madam Yetunde, can you speak? Just 1 minute. Our time is fast spent. We want to round up the program for today. Please unmute yourself and speak.
Thank you so much,
Hello.
Ma. Hello, Ma.
Are you there?
Yes, can you hear me, Ma?
All right. Hello, ma. We are hearing you. Please.
Okay, I'm Adeleke
Yes, ma. Speak on.
University College Hospital, Ibadan.
Hello, ma. Speak on.
Yes, I'm Adeleke, nurse Adeleke Yetunde from University College Hospital, Ibadan.
Thank you.
I'm a public health nurse, and I want to appreciate you all for this wonderful presentation. As a public health nurse, I want to know if there is any collaboration between the renal unit and the community health nurses in exposing these people in the community on this information. A lot of people are dying there with kidney diseases, but most of them doesn't have even this information that we have challenged to have. So I want us to please collaborate with the community health nurses so that they can go to the roots and give people informed knowledge on what to do, how to go about it, so that they won't have kidney disease. That's just my question. Thank you so much, ma'am.
Thank you for your commendation. We'll look into that. Time for our CMAC for your comments, your commendations, sir. Can you unmute yourself and speak?
Okay. All right.
Dr.
Thank
Odega,
you.
please.
Yes. Thank you
Yes,
very
sir.
much. And good morning, everyone. Our time is fast
Good morning,
spent.
sir. Good morning, sir. We are greeting you.
Thank you. Thank you. Good morning.
Yes.
Just to also appreciate
Yes,
the Department of Nursing Services, as well as the Therapeutic Care Committee for putting this together. We are happy that a lot of awareness has been raised about kidney diseases, and awareness also about our approach to our lifestyles and routine medical checks. Some problems and challenges have also been raised, just to inform us also that very soon a refresher course in post-basic nursing nephrology will kick off. It's a nationwide program. This is one way also we're hoping to improve the skills of our nurses. And of course, a new school complex is being built that will also help to improve the standard of nursing nephrology. The management is also has put it in the budget for a purpose-built renal care center. All these we're hoping will help to use the burden and provide better care for our patients. The problem of dialysis has also been mentioned, the high cost. We're hoping that with time, our cost also will reduce so that those who need dialysis will be able to afford it. Thank you very much.
Yes, sir. Thank you so much, CMAC, for that commendation and recommendations. We are hoping for a better UITH. Our time is fast spent. Before we round up the program, on behalf of the Therapeutic Care Committee of University of Ilorin Teaching Hospital, we want to send our condolence to the Department of Nursing Service for the loss of one of them, Mrs. Grace Salami, a unionist to the core, and a perfect nurse. Yes, that was it. I pray that soul rest in peace. And we also pray that Almighty God will give the family the fortitude to bear the loss. So, ladies and gentlemen, thank you for joining us today. Until next month, when we will have another department for this program. Thank you all. Have a nice day. Bye-bye. Okay, you can comment.